This is QD Clinic, and I am Dr. Jack Cush, and you are here because we're having fun. QD Clinic is brought to you by our coverage of ACR 2020. Our case today is dealing with surgeons. So, a 54-year-old fellow who's got well-controlled rheumatoid arthritis, taking a JAK inhibitor, which he says has dramatically changed his life. He's really taking no other medicines, and he's got to go and have some neck surgery. And he didn't tell me of this because it was about 3 or 4 months after I last saw him that he had it done. It was right after COVID. And so what's happened? His neck surgeon, the neurosurgeon, gave him all the instructions on how to prepare for this and what to do with his anti-rheumatic medicines. They told the patient, oh, we called Dr. Cush and they said that you should stop your JAK inhibitor for 1 month before and 2 months after because it impairs wound healing, or it can cause an infection, or it's because this is what I do because I'm the surgeon. My goodness, it's the most disastrous thing that can possibly happen. So this is how I deal with it. First off, you know the research here. The literature is very clear. All DMARDs should basically be continued all throughout surgery. There's really no reason to stop. Steroids should be continued throughout surgery, and really there's no reason to use stress doses of steroids anymore. That's been proven not to be beneficial or effective. Just gives the patient more steroids than they need. Biologics, the rule is stop for 1 dosing interval. So here's some particulars. 1, let's talk about nonsteroidals. That's very clear. Nonsteroidals, aspirin, 7 days before, and then they can resume them as soon as they get home. When it comes to DMARDs and even most biologics, I tell the patient, listen, talk to the surgeon. Get out your pen, your paper, write things down. Like when he says, do this and do that, and you go, and you write stuff down, and you look at it and says, I got it, doc. And then when you get home, you can take that and you can throw it away and you call Dr. Cush and he'll tell you what to do. If it's methotrexate, sulfasalazine, whatever, I'll say, take it 1 week before surgery. Don't take it the week of surgery. Take it and then restart everything 2 weeks after surgery's done or when the sutures come out. That's not stopping any drug long enough to get into trouble. And it kind of makes the surgeons happy. It's sort of a compromise between their idiocy and our being hardline and evidence-based. That actually works. That also works for biologics, where the rule is, again, you don't want to be at peak drug levels. You don't want to take your infliximab the day before you have your hip replacement. You want to be somewhere from the peak levels down, but not washed out, because washed out means no drug and inflammation and flare with inflammation. And inflammation drives risk for poor wound healing and or infection. So you want to be off the biologic for, a week or 2 or 4. 1 dosing interval. It's a Q2 week drug, be off 2 weeks. If it's a Q4 week, be off 4 weeks. And then have the surgery and then restart the biologic when the sutures come out, assuming no infection, no complications of surgery. These work, and the patient needs to know that you're the expert. You're the one who has a plan. Again, you need to sound as forceful and as certain as the orthopedist does or the general surgeon does. But we know their guidelines are not necessarily based on any evidence. So if you're a surgeon and you don't like what I just said, I'll meet you in the parking lot. We'll discuss this. That's it. Tune into Room Now and our coverage of ACR 2020. We got a few new cool things that you're going to see on our website every day. ACR quiz. It's actually called ACR IQ. You can quiz yourself on what happened at the ACR just today. Second, there's ACR chat. You're a psoriatic arthritis guy, you can get involved in ACR chat on things that were just presented on psoriatic arthritis. What's the other thing we're doing? It's kind of cool. You can sign up for topic news. You're a gout person, you're a myositis person. We're collecting the information, we're indexing it. You can get a post-meeting email that will have all the citations we cover on your disease. You can sign up for that by going to the website, signing in, and choose your topic under emails. You can get a topic email that'll come to you. It'll come to you Monday night, the last night of the meeting, and you'll get the whole download on all your lupus information for you lupologists. So a few more interesting things that you'll see, but tune in and check them out. Bye.